Welcome to Direct Primary Care Benefits Podcast, your resource to understanding how DPC and the direct care model is fixing healthcare for employers and individuals alike. Learn from the most innovative and disruptive business executives, brokers, physicians, and healthcare influencers that are in the trenches, changing the way employee benefits are being administered across the country. I'm your host, Brett Shoemaker. Welcome everybody to episode 2 of Direct Primary Care Benefits Podcast. This is your host, Brett Shoemaker. And today I am very excited and grateful to have very special guests all the way from North Carolina calling in here. And we've got Miss Cristy Gupton with Custom Benefit Solutions. And so, Cristy, why don't you tell everybody hi?
Hey, y'all.
Hey, y'all. I love it. I appreciate that. So, guys, just a little bit about Cristy before I start diving in here to some questions. Cristy was the 2018 and 2020 Employee Benefits EBA Top Woman in Benefits Advising Charter Top Broker of the Year. And she is also a certified Health Rosetta advisor. So for those of you that are out there that don't know that, Cristy, that'd be a great way to hop in here. Why don't you tell everybody what Health Rosetta is and what Health Rosetta does and why that's important for you, because I know a lot of employers and brokers out there may not be aware of that.
Sure. So some years ago, a guy by the name of Dave Chase, through his own life experiences, became very passionate about solving healthcare challenges. And that led him to looking at the healthcare system, and then by default, it led him to the employee benefits advisor space. And what blossomed out of his research and setting up, some channels for people to do things better and infrastructure, that's really, to me, what Health Rosetta is. It's a great infrastructure and a place where I can collaborate with advisors who think like me, right? Who know that the big in healthcare, the big insurance companies, big hospitals, big pharma, all that can be detracting from value-based healthcare. So he co-founded the Health Rosetta. I don't remember the year of that, but I came along in 2017, and it's just been a great experience since then. And then to throw one more group name at you, a handful of us that were, dedicated in the Health Rosetta model got together and formed another little group, not competitive to Health Rosetta, but just part of it, called Mitigate Partners. And so there's about 30 of us across the country, and we get together every 2 weeks and just collaborate with each other. We contribute ideas and shared experience and vetting into a health plan we call the Fair Cost Health Plan. And then we just support each other and help each other through this interesting industry that we're caught up in. I honestly think it's the hardest job in America, but I won't.
It is the hardest job.
That's a little dramatic.
Hey, that's a great way to put it. It's the hardest job in America, but the most rewarding whenever you're able to get companies to see what happens and the magic that can be done in self-funded. And so for those employers that are out there listening, I'll give you a little bit of background on Cristy. On a personal level, not only is she the mother of 2 boys, right? She runs an employee benefits company, and she is a part of, I have seen just about every, like she's mentioning these associations and different groups. She is out there on LinkedIn and just doing her thing. And I just appreciate you, Cristy, for all the different hats that you wear, and you are so passionate about this and so gracious with your time. So I just want to commend you and congratulate you and just tell you thank you while we're here, right here on the podcast, for being the person that you are.
I really appreciate that, and it is not done in a vacuum. I have so many people that support and lift me up and help me when I don't know which steps to take next. So I have to turn around and thank all those people who have brought me to this place. So,
Well, I appreciate that humility. Well, Cristy does 100% self-funded plans. And so, Cristy, when we're out there talking to employers, I want to ask this question. You dealing with 100% self-funded plans, what companies or what percentage of companies are self-funded before you take them on? Or do you typically find yourself converting them to self-funded or enhancing their currently self-funded? Tell me a little bit about that.
yeah, I haven't had yet the experience of flipping a fully insured plan to self-funded yet. I'm sure that's coming, but so far, everyone that has come to me has been on a level funded chassis. So it's still self-funding, but some actuary somewhere, has crunched the numbers and decided, okay, this same premium amount every month for a year should pay your claims, right? So that's always with one of the big carriers. And so if I start with them maybe 90 days or 6 months before we put them with an independent third-party administrator and an independent, pharmacy benefits manager and all those things, then that's historically that's been how I've started with my
Gotcha.
clients, is through a level funding. So it's almost like they went ahead and took a baby step into self-funding, seeing claims, seeing data, acting on that, and understanding where you can change things to get better value.
Well, let's
And
unpack
yeah,
that a little bit, Cristy, because you talk about level self-funded and self-funded. Why don't you go ahead and educate everybody what the difference is between level funded and level self-funded, and even maybe some of the differences as you compare that to fully insured? Because I know a lot of employers that are out there listening are like saying, what in the world is difference between level funded and level self-funding and just being self-funded? Go ahead and break that down for us a little bit, unpack that and all the different parts, the TPA, the PBM.
hmm so let's start all the way over. Let's almost like a linear thing. So let's go left to right, just like you would read a book. So
Love it.
say over here on the left is fully insured. Those are all pretty much related to the big carriers, right?
The bukas.
Um, that's right, the BUCAs. And so being fully insured, an employer has just simply said, tell me what I need to pay and you take care of the rest. And everything is all vertically integrated. It means the carrier and the pharmacy benefits manager have a relationship. And so they're sharing the employer's money with each other. And then the carrier and the PPO network are owned by the same entity, or the carrier has set up their own network of providers, right? And they're sharing money with each other. Or the carrier is just spread pricing, the PPO network. And then every other piece, every other moving part of a fully insured plan is another stream of revenue for the carrier. And when the employer is blind to that, they've really almost like delegated their fiduciary duty to part of and I'll just use a wild and crazy word here, and I'm just going to have to say, brace yourselves. But
We're
they've
braced.
delegated, yeah, they've delegated the care of their employees to the cartels. The bigs in healthcare act like cartels. You know what? So I'm just going to call them that. That's what they behave like. So let's move a little more to the middle of the road. So we're reading from left to right now. Now we're about in the middle of the page. So an employer says, wait a minute, I don't like what's happening here. I need more insight into how our money is being spent. And frankly, they have a fiduciary duty to oversee that. And a couple, in December of 2020, when the Consolidated Appropriations Act, that became part of the law. So they really have a reason to start looking more intently on where all the money is going. And level funding gives them a baby step in the right direction. So they do see some claims data. With the big, they see a very limited amount, but at least it's something. They do maintain like a claims account, and so they can start to see after claims are paid what's left over every month, and that's very insightful. And then reading even more over to the right, then you've got self-funding, partial self-funding, a lot of people call it, because most employers need to buy the catastrophic insurance that's part of every health plan. Even the BUCAs buy stop-loss insurance. On the fully insured side, a lot of them like employers to believe that everything is insured. Primary care, specialists, hospital care, even all the way up to the total catastrophic care. They want you to believe that all of it is insured, but that's false. So when you become self-insured, you start to see very clearly the only insurance that matters in a health plan is stop-loss insurance. That's the catastrophic insurance. Everything else that's everyday care can be paid for with cash. Okay? So,
I love it. That's a great explanation. So go with me here for a minute, because obviously whenever we start going self-funded and we start to move away and start to see this claims data, share with everybody where this claims data and this newfound exposure of claims data, where does that come from, and why isn't that available, or why isn't it as readily available when you're dealing with a fully insured plan?
Well, the claims data is where the details are, right? That's where the devil lives.
The devil's in the details, right?
The devil's in the details. So the claims data is showing you who's the provider, how much did they charge, how much were they paid out of your plan's assets, what was the diagnosis code, who was the employee, and it leads you to make certain predictive, analytical decisions if you're smart about how you're spending money in your plan. So let's just take musculoskeletal surgery as an example. If you're looking at claims data properly, you can see when an employee was referred from primary care to an orthopedic specialist. And you can see when an MRI was either pre-certed or paid for. And you can start to make assumptions that, that employee might be headed into an operating room somewhere. Now,
probably a good guess, right?
Right. Musculoskeletal surgeries can go very bad very easily if you don't have a high quality person, doctor holding the scalpel, right? So any smart plan should be looking for the highest quality practitioner they can find, because the most high quality they can find always leads to the most reasonable cost. And most of the time, when you've got a general surgeon operating in a big hospital environment, that surgeon may be basically good, but maybe they're not the best at that particular surgery. And so,
but because they work for that big entity, they were referred by the primary care, and that doctor and that facility is trying to keep all the money in-house. And that's where I think people really don't understand that concept, Cristy, right?
That's right. Many people don't understand how the cartel operates, and they go all the way downstream, and they buy up every primary care practice in town. These hospitals, especially when the Affordable Care Act was passed, they got a whole bunch of found money. And they were able to buy all of their primary care assets in their communities. And so then those primary care practices just became feeders to the mothership, right? And essentially they set up an environment where if the primary care doctors don't feed the mothership, they get penalized, maybe even fired. So it's insidious what's happening, no doubt about it.
And so what Cristy's talking about here leads us right into the fact that we talk about these health plans and we talk about direct primary care, and that is really the foundational piece to really make magic happen with self-funded plans, Cristy. And so you say that out of all the plans that you do, about 50% of them really due to supply and demand are with direct primary care. And I work for a direct primary care a group of clinics here in Houston, and we do plans obviously all over Houston and Texas and beyond, but you do the same exact thing. And so let me ask you a question. When we talk about direct primary care, why do you like to use direct primary care on your plans? And I know that you're a big proponent of it and you would like to use it on 100% of your plans if you could. And you were just telling me a story of one that you have that is going to be moving that direction here in the upcoming years. But talk to me a little bit about why you like to use direct primary care as a foundational asset to your health plan.
I'll go back to that Buckminster Fuller quote. So Buckminster Fuller was like an economist and an inventor and sort of like a futurist way back in, I don't know, the 40s, 50s maybe. And he has this quote, and he says, you won't change things by fighting the existing reality. The only way you're ever going to change anything is by creating an alternate reality, which makes the existing one obsolete.
Oh, that's awesome.
So the big cartel operations, I am not going to be able to change them. And I have some fight in me. Yes, that's true. I'm not afraid of a challenge, but I know when I'm outmanned and outgunned, right? So it's just important for me to create an alternative plan that works better, costs less, and employees like it more. Frankly, I think that makes the big obsolete. So I'm just going to do that.
Absolutely. So direct primary care is obviously one of the reasons that you are so passionate about this, or so passionate about doing employee benefits. But let me ask you, was what your background? You were by trade, you were kind of in healthcare space early on, right? You even were going to go thinking about moving in the direction of going to medical school and studying for the test to get in and all that good stuff. But tell me what kind of hooked you in when you started doing employee benefits with your parents? You came from second generation employee benefits family?
Actually third, if you can believe it. My dad's mom, my nanny, she had, it's not necessarily employee benefits, but she was the first in our lineage to foray into the insurance world, So she had a little local P&C agency in our town. And when she passed away, my dad acquired it, and that's kind of when I started, working for the family business. And third generation.
Third generation employee benefits. I love it. And so at what year did you start to find out about direct primary care and start utilizing it? Because most people, they think direct primary care and concierge level benefits, they think this is new, but what year did you start using it? And what year did you start to see the influx and everybody start to really jump on the bandwagon? Because I feel right now, Cristy, I don't know if you would reciprocate this, but I feel like we're in this vacuum where people are coming and starting to really want to know how can they utilize direct primary care? How can they change their health plan? Maybe they don't even necessarily know about direct primary care, but they know that there's this better way and this concierge level service out there. So when did you start seeing it? When did you start, really becoming a proponent? And what is your vision for the future?
Mm-hmm.
A lot of questions there, right?
Yeah, that's okay. It's all good. My eyes were really opened when I became part of the Health Rosetta, and that was in 2017. In 2018, me and a buddy of mine and a DPC doctor from South Carolina, we started up the North and South Carolina chapter of the Free Market Medical Association.
Oh, nice.
So yeah, you've got a big chapter there down in Houston, and so that was something co-founded by Dr. Keith Smith and Jay Kempton. And so when I heard a podcast, actually, that Dr. Keith Smith did, it just changed my whole world. It made me see things so much more clearly about how healthcare should be delivered. And so I called up my buddy David Contorno, and then he turned around and called Dr. Shane Purcell, in Anderson, South Carolina. And so that was really the first time I had ever met a DPC doctor. And I went and visited his practice, and everything just sort of snowballed from there. So I think that goes back to 2018. And since then, I've visited probably every DPC practice in the Carolinas that I can get to anyway. Of course, more keep opening, which is a wonderful thing. So I've got some more travel to put on my little Toyota Prius.
I love the fact that you actually go out there, get in the trenches, and meet these DPC doctors and see the level of care and how they're doing it. Right?
It's important. Yeah, for me, it's very important to do that because sometimes you can be fooled. Some practices can call themselves direct care, and I wouldn't have seen how easily it was to be fooled if I hadn't gone in the Asheville area. Now, Asheville, North Carolina is not very far away from me, only about a 45-minute drive. So I have a few clients there, but the first one I ever got there, they had a relationship with one DPC doc, but there was like 6 in Asheville that, and we wanted to know which ones were good and which ones wanted to work with employers. So I got in my car and I went and visited them all. Well, I went to this one and I walked in the front door and there were like 8 people waiting in the waiting room, and that stopped me in my tracks. I was like, wait a minute, this doesn't look right, because I had traveled all over the Carolinas meeting with other DPC docs, and I had never once seen a person ever waiting in the waiting room. Well, turns out this particular practice I went into that day was a hybrid, and it just didn't cut the mustard. It just didn't
cut the mustard. I hear you.
So it's important for me. I just can't take somebody's word at face value. I have to go check it out for myself.
I love that. Now, let me ask you this. How would you, I've heard you answer this question before, so I think I know what you'll say, but I'd love to hear it. What would you and how would you classify and explain a direct primary care operation to somebody who is not familiar with the concept or the model? How would you explain it and verbalize it in your words?
Well, I have a little tagline. I call it, "This is your personal physician on speed dial." Now, speed dial harkens back to someone my age, right? Do you remember when you had those presets on a...
I think you could still, I know you're an iPhone person, but I think you could still do it on Android. I just don't ever set it up.
Well, I mean, right now, Siri does it for you, right? You don't have to press a button.
There you go.
Back in the day, back in the day, you have these preset numbers on your phone that might have had raised buttons on it, like like the phone in your mom and dad's house.
Yeah, the yellow. I used to call them the yellow brick phones, the big square yellow phones.
Well, you push this button and it was preset to dial the same number, and so that was considered speed dial. Well, now all you have to say is, "Siri, call Dr. Kramer," or whoever, and they got the phone dials it for you. But this is really just a way of thinking about, and I think I came up with that tagline when I was explaining how telemedicine is different from direct primary care. And I said, with telemedicine, you have a random experience every time, because a different doctor may pick up the phone every time. But with direct primary care, you still get virtual care, but it's your personal physician on speed dial.
Yes, you get that one-on-one relationship.
Yeah, so it's relationship medicine, not assembly line medicine. And because your doctor knows you so well, that is very beneficial to a health plan, because they don't have to make mistakes not knowing you personally, right? They don't have to overprescribe or, do things that are unnecessary just because they feel like they have to cover their butt. So in direct primary care, your physician knows you. You have a relationship with them. And the fact that you can call them up or text them or email them or do FaceTime or whatever the need calls for at the moment is also a savings to the plan. Because, this happened this weekend. my son, my oldest, who thinks he's a pro level football player in high school, wakes up on Saturday morning and says, I can't straighten out my elbow. And so we start talking about it, and he tells me how it got hurt. And so I say, well, let's just see what Dr. Kramer has to say about it. And that's our DPC doctor, by the way. And so I text him. He calls us back, and he says, that sounds like a hyperextended, elbow joint. And, if you'll just ice it and take some ibuprofen or whatever, it should loosen up throughout the day. And it turns out Dr. Kramer was right. And that right there saved us a trip to an urgent care where there might have been an x-ray done and so on and so forth. And so I think that employers really need to understand how beneficial direct primary care is to the cost of their plan. Their plans right now, especially if they're overseen by the bigs, are being unnecessarily bled dry, have not seen the light on direct primary care.
Absolutely. Absolutely. Well, Cristy, I appreciate you so much for coming on the podcast today. And I know everybody can find you. You've got your own podcast that I have actually listened to myself. So definitely has some great guests on there. Actually, I'm trying to get Doug. Doug's on my list next. So I got to definitely get some other contacts from you as well. But you're hearing from Cristy Gupton, the 2018-2020 EBA Top Women in Benefits Health Rosetta Advisor. And Cristy, I just appreciate everything that you have shared today. And I want everybody to know how to get in contact with you. Obviously, you're in Morganton, North Carolina, right outside of Asheville, it sounds like. But tell everybody how they can get a hold of you, how they can get in contact with you, and anything that you'd like to share before we close out here.
Sure. Feel free to send me an email. Actually, though, my name is spelled a little differently. It's Cristy, and then at custombenefits.work. I look forward to anyone that I can have a conversation with about this. And I love it. I love talking about this stuff.
Well, Cristy, I will put that information on the show notes here. And before we close out, I've got one last question for you. If you were talking to an employer out there that wanted to know, hey, I want to understand this self-funded from a third-party, unbiased source, where would you direct them to either read a book or hear some information to really kind of open their eyes to self-funding and what direct primary care is and what's out there? What would you recommend to them to read and research to make the decision to be thinking smarter for their healthcare benefits?
Well, I honestly think that employers are most convinced by their peers in the industry, right? So I can go to an employer and talk all I want to about this stuff. But when they hear it from another CEO or another CFO or another HR director, in their community, then they believe it. So
the social proof.
That's right, the social proof. So Dave Chase just wrote almost like the third in a series of his books. So the first one he wrote was The CEO's Guide to Restoring the American Dream. And then the second one had to do with community-owned health plans, and it was called Relocalizing Health. This latest thing that he's written, and I'm not even sure it's out in print, but I have several copies. So if anybody wants one, I'll be glad to mail it to them. It's called The CEOs Who Restored the American Dream. So in other words, they learned about it, they did it, and now they're on the other side better off than they ever thought that they would be. And so this little book, it's only, it's only 150 or so pages. It's a couple handfuls of case studies.
I've got it in my hand. I've got that book in my hand right now. Dr. Goyle.
Dr. G brought it to you from the Health Rosetta Summit, didn't he?
Yes, he did. So I've got one in my hand. So I love that. So that's the one. Okay, cool deal. Well, listen, Cristy, Thank you so much for joining us today. You guys have been hearing from Cristy Gupton out of Morganton, North Carolina with Custom Benefit Solutions. So make sure you go to her website at custombenefitsolutions.work and learn everything. I will put all the information and your contact information, Cristy, in the show notes. But thanks again so much for joining us. And I look forward to continuing to stay in touch and seeing you at some future conferences.
Excellent. I look forward to it too. Y'all have a great day.
All right. Well, thank you everyone for joining us. This is episode 2 with Cristy Gupton here with Direct Primary Care Benefits Podcast. Make sure that you go onto your favorite podcast platform and subscribe, and make sure that you give us a review. Let us know if you've got some value out of today's episode, and we will see you next week with another healthcare influencer. And I look forward to sharing and continuing to fix healthcare. So this is your host, Brett Shoemaker, signing off. Have a great day, and God bless.